Hi, Auntie Marcy. I just want to thank you for allowing me to spend this time with Micah to be able to uh, use him as a way to kind of learn more about his nutrient intake. And as we went over, he's 5'2", 100 pounds, very active in terms of sports of volleyball, soccer, and basketball. And I'm in terms of his diet, he eats a lot of rice, pizza, beef, desserts like ice cream sandwiches um, um, and cookies. And so I just want to go a little bit deeper in terms of things that have kind of stuck out to me that would probably be alarming if not addressed sooner. And so I'm just gonna go dive right in. I've noticed that he comes to his meals, he eats a very high carb processed diet, um, and also a high fat and high sugar diet. And so when it comes to this, it pretty puts him in a dangerous position in terms of in the future because it puts himself at risk for different complications like type 2 diabetes and heart disease. Um, but one of the main things that really struck out to me is his fiber intake. He is only averaging about 5 grams of fiber um, every day, which the recommended intake, if you don't know, is about 30 to 32 grams of fiber for his age group. And so each meal he doesn't pretty much doesn't eat enough whole foods that would help with the fiber. At the same time, he he has in terms of his calorie intake, he's only eating about 1,200 calories per day. He should be averaging about 2,300. So in terms of his weight, in order to maintain that proper weight, he's gonna have to put a little bit more calories in his diet. Where we use more of a whole foods, especially in the areas of legumes and beans, to kind of help with that and good fats as well. As far as his sugar intake, is he's eating about 59 grams of sugar per day. Usually the recommended is about 25 to 30 grams for his age group, and so as far as sugar, it's really kind of putting himself at risk, for type 2 diabetes. Um, and we definitely want to be able to address these issues. Also, some of the things that in terms of micronutrients and minerals, he lacks vitamin A, um, also vitamin B1, vitamin B2, um, and other areas is also vitamin C, which you can easily uh, increase that by eating a lot of oranges as well in his diet. As far as minerals, calcium, his calcium intake is low, and a lot of the calcium you can get it from celery, and so celery has a huge amount of calcium, which is something that we want to be able to address, and of course magnesium and phosphorus and potassium is pretty low intake, and so see these are just some things that are just alarming, stuck out to me, and so one of the things that I want to address is be able to fix his aspect of fiber. Fiber is a very, very important part of our nutrition, and is something that we want to be able to get enough of when it comes to in his diet. So, because he has a low fiber intake, he only gets about 4.9 grams per day. It puts him at risk for constipation. To give you just a little bit of education of if we don't fix it, or if we don't take care of address these issues, puts him at risk for constipation, diverticular disease, heart disease, strokes, and diabetes in the future. And also a little bit more education. He, eggs, meat, and milk, which I've noticed he has a lot of high intake of those things has zero fiber in them, very little fiber in them, and eating foods can easily help with toxic substances and carcinogens, and also prevents cancer, and also helps with bowel movements and prevent constipation. Also, another thing I wanted to address was, of course, the sugar. The recommended sugar intake is usually about 25-30 grams of sugar. He's at around 59 grams per day, and you know, having that sugar intake puts him at risk for type 2 diabetes. And one of the things, the problems with type 2 diabetes kids is usually the high blood sugar levels, when the insulin is either inadequate or not responsive when it comes to with the cells. And so putting himself at type 2 diabetes also puts him at risk for heart disease and atherosclerosis disease as well, and it can eventually lead to retinopathy and kidney failure if not treated properly. But the good news is that we're catching this early. A lot of times type 2 diabetes is usually found in adults, and usually for many years. It was very rare to see kids have type 2 diabetes, but because of processed foods and cereals and all these different kinds of packaged foods that have high sugar drinks and sugar content drinks and sugar content breakfast meals, kids are now starting to develop type 2 diabetes. And so one of the things I would definitely want to recommend with him is to be able to put more of incorporate more whole foods. And some of the things that you want to deal with, especially when it comes to the fiber, is incorporate in breakfast, like an oatmeal or granola, and raspberries and blackberries, which is a good way to help with his fiber diet. And maybe for lunch and dinner, have some like steamed or broccoli and peas, and in dinner for maybe have like some type of lentils and egg beans, these are just foods that are whole foods that are mixed, which increases fiber intake, and it's been known also to help with cholesterol. And so you may not have these factors right now, but if we can address this now and develop good eating habits, it'll be easier. And one of the things that you want to do is you want to introduce these foods one at a time. You don't want to overwhelm him, especially if he's not used to eating whole foods and his palate needs to change. And try to introduce them once a week, one food at a time is a really good way to kind of prevent that from him fighting back. Also, one thing I want to address is the aspect of diabetes. And so one of the things that you want to incorporate is more of that aspect of whole foods. And so if you can add more of like the fruits and vegetables in his diet, like pineapples or smoothies, and kind of and stay away from these processed sugars, it could really help his ability to decrease his chances of diabetes. And so if you want to include more also garbanzo beans and lentils and almonds, all these good fats, they're also known to help reduce blood sugar levels. And one of the things that you want to stay away from is snacking between meals, making sure that he gives his body enough time to be able to digest each of the meals, and making sure that he eats good quality meals. And so overall, I think these are just small changes that we can make together in terms of his diet, and I think in terms of his progress, I think we'll be able to make these changes over time. So I would love to see Micah again in 3 months to kind of make sure that he's on track, on plan, and be able to see how his progress has been doing. So I just want to thank you for coming in. I hope that this was helpful to you, and I'll see you again soon.